I am a gynecologic oncologist. Gynecologic oncology is a subspecialty within obstetrics and gynecology. After becoming board certified in obstetrics and gynecology, we had specialty training in gynecologic oncology with subsequent board certification. I came to Florida in year 2000 and I have been practicing gynecologic oncology in the area for 11 years. I feel the community physicians should use Delray Medical Center and send their patients here for surgeries or other ancillary testing, as I feel the hospital offers excellent clinician, excellent imaging services, and the anesthesia services, the floor nursing care is excellent, and I would not hesitate to have my patients come here to have any surgical procedure or intervention. Delray Medical has been avant-garde with all the technologies available during the last decade. Ever since I've been here, any piece of equipment which I have been interested or I have been motivated to try, I've been able to obtain it within a reasonable time, and I've been able to offer this to my patients, and I can attest the same for other clinicians that come here. They have been very satisfied. Many of the procedures that I perform here at Delray are difficult pelvic surgical cases, cancer cases. A lot of the technology available now at Delray has allowed us to perform these procedures minimally invasive. This ultimately translates into easier recovery and less postoperative pain for the patients.
My name is Eleanor Romberg. I'm 81 years old, and I have 3 children, 3 sons, 3 daughter-in-laws, 5 grandchildren, and 2 great-grandchildren. Eleanor
is an 81-year-old female who's a patient of mine for approximately 5 years. I believe in 2008 we removed that endometrial polyp. The patient came to me from one of the local physicians after an ultrasound identified the polyp. Most recently in August this year, she complained of pressure, pain, and a repeat ultrasound demonstrated another polyp had come back. Of course, in 2008 we had recommended a hysterectomy. However, that would have entailed a major surgery, hospitalization, and 4 or 5 day admission with postoperative pain issues. So we elected just to remove the polyp, and she was aware that there would have been up to a 20% chance that the polyp could come back. Indeed, it came back, and now with the technology that's available to us, the patient was able to tolerate an outpatient procedure and go home removing the uterus, tubes, and ovaries with the polyp. The patient went home 23 hours after the procedure was done.
My first surgery was actually as an outpatient surgery. I went in the morning and left in the evening. My second surgery, I had to remain overnight, and it was done by the Da Vinci method, robotic. If someone were to ask me or tell me that they are frightened of having this surgery, I would really try to convince them to go through with it, because things are so different today. The robotic method is very quick, and your healing is much quicker. You feel much better afterwards.
Minimally invasive surgery has become more sophisticated throughout the last 2 decades. With the advent of robotic surgery, now the patients are able to have their surgery in an outpatient setting. This ultimately minimizes infectious morbidity, lessens the necessity for pain control, and also offers the patient the ability to regain their full activity within several days.
I think what surprised me most was how fast you do recover. I know that Dr. Riccio said to me that it would be quick, but in the back of your mind you still have that little question mark. But it's actually true. You do recover quickly and you get on with your life. I have to say the staff was attentive and very, very lovely.